Suppose you're sick and you go to the doctor and the doctor tells you, I can't treat you because I don't believe in the way that you live your life. How would you feel? Would you be angry or understanding? If this doctor doesn't want to help you, maybe no doctor does. But why does it matter how you live your life? The only concern he should have is whether or not you have health insurance. What if that same doctor told you, I can't help you because you're a male, or because you're Hispanic, or because you're 45 years old? You would know immediately that that's against the law, and it's called discrimination. This is a problem that the lesbian, bisexual, gay, and transgender community faces every day. According to the LBGT Cancer Network, 1 in every 5 person in this community is faced with this problem every day and is turned away by a healthcare provider for that very reason. What this country needs to do is implement a healthcare provision anti-discrimination act that prevents healthcare providers from turning away patients based on sexual orientation, gender identity, and gender expression, just as it is against the law to turn away a patient for their race, sex, age, and so forth. The lesbian, bisexual, gay, and transgender community is an at-risk population, and what that means is that they are at a higher risk of transmitting and developing diseases that the straight population is not. These include substance abuse, certain cancers, and most deadly, HIV. The CDC reported that in 2010, 78% of the cases of new HIV were male, bisexual, and gay populations. In a report published by the Kaiser Family Foundation, individuals who are not out to their providers, which means their providers don't know that they're lesbian or bisexual, gay, or transgender, are not adequately screened for these diseases, so they can't be prevented. So what has the country even tried to do to prevent this discrimination? According to the U.S. Department of Health and Human Services, it started with Barack Obama and his passing of the Affordable Care Act. What that did was not only provide health insurance coverage to the entire population, it also prevented health insurance companies from discriminating based on sexual orientation, gender identity, or expression. But there's more that we can do, because we've done it before. There have been over 27 amendments to the United States Constitution upholding civil rights. Some of these include Equal Employment Opportunity Acts, Equal Housing Acts, prevent landlords and realtors from not selling or not renting to someone based on their age or race or gender. And it also prevents employers from discriminating against applicants who are of different national origins, race, or gender as well. And these amendments have obviously worked, because when was the last time that you saw someone own a slave? It's been over 100 years, because President Abraham Lincoln implemented the 13th Amendment to abolish slavery. So obviously, implementing these civil rights acts work. So why can't we do it for the lesbian, gay, bisexual, and transgender community as well? It only takes one person to see that there is an issue at hand and that there is something that we can do about it. It doesn't cost any extra tax money out of your paycheck to implement this type of act. You don't have to miss work to go and vote on this type of act. It simply needs to be seen by the higher powers in our government that this type of discrimination has to end if we're to improve this country's overall health as well as economy. Thank you.